Now, looking into the scenario where 20, 30 years back, there were more geriatric patients with metabolic syndrome. Today, more younger generation is. So how you see this change and how you are tackling the situation?
I, for one, would say young people are getting into metabolic diseases is mostly because of the diet. I see diet and lack of exercise. So whatever we do it in a room. Recently, we see people all are working from home. Like you sit around a desk, you sit around a table, you're doing things, and you have no physical exercise. Even us, our profession, any field, even surgery, non-surgical fields, we're just in a table doing things. People think they're working, but they're working mentally. Their physical body is not being active one. So our diet is mostly composed of carbs, trans fat. Everything we see, I say to my patients in Nepali, tareko, poleko, bhuteko are the only things we're eating. Everything we eat is ready-made, so that's the leading cause of metabolic syndrome.
Welcome to HELLODOC. Today, the word is so much engraved into various types of diseases, problems, and everybody is running around doctors, medical colleges, nursing homes. But still, the people are not getting what they want. And that is why the medical fraternity has a very important role. So, Arya Pharmalab brings in this program what actually the doctors are going to offer to the common man. That is our motto in this program of HELLODOC. So, every week we will be coming out with one doctor who will be with whom we will be discussing on how he is going to serve the society. So with me today is Dr. Prashant Thapa from Kathmandu, and as I have been always saying that the medical fraternity is like a god to the society. So sir, I would like to just how you have started your journey and what are the challenges you faced in your journey and how you see your journey ahead.
Thank you for having me. So I basically started my medical degree, medical school from Nepal Medical College, Jorpati. My father is a pharmacist. We have a small medical there in Jorpati, where I currently work. And studying medicine for me was always a dream. It was kind of hard to get actually. Exams, entrance exams, it was tough. It's way tough now, but it was way tough back then. We had to give separate exams for every university, Kathmandu University, Tribhuvan University, Dharan, Patan, and I gave all three exams. I didn't give Dharan because it was in midwinter and I couldn't give it. And NMC, I studied in Nepal Medical College, Jorpati. It was quite near to my where I stay. And for me, studying MBBS has been a gift actually. Like I had never thought that I would be able to get my graduate degree from a place where I've always seen it grow, and I've known the place. And yeah, studying medicine as a whole is hard, but if you have a good interest in what you're doing, then it's not so hard. The subjects, if you just turn the pages, it's hard. Like you see new things and all those medical things and all, and you see that. Um, it makes you realize at a point, what are you doing here, what, like, can I be able to do this? But you go on, you keep on doing it. Yeah, there are things that make you sometimes, that think about around, like, will I be able to do this? And you see around people, everyone is doing it. In life, we have to do something, and I pursued medicine thinking that we have to do something, let's do this. So yeah, it was a roller coaster actually, but yeah, we did it somehow.
So, as you said, that quite a challenging, but finally, when you decide that yes, if others are doing, why can't I can do? So, like it is for everyone, but many times people leave it the journey in between that they find it. So, how you keep yourself motivated in such a situation, sir?
So yeah, studying medicine is hard. Thinking about patients is even harder because we're in a current state. Nepal is in a state where people think doctors don't make errors. We should not be making errors. And so that's the most I what I find after working. During my studies it wasn't hard. Like, you study and you're like, okay, you study, you give medicines, the patient will be fine. So coming on the ground, treating patients is not that easy. And the most difficult thing that I think we see as clinicians right now and then is um, perceptions of people are really hard to treat in Nepal. Like, they think we give one two medicines and they're like, okay, it will be better. And like, we give a third medicine and they're like, why are you giving so much medicines? Will not the two medicines work? So working as of now is hard in hard here, but um, it will go on actually. So it's not something that people leave. I've seen. So we were a lot in medical school. We were around 115. Two of my friends dropped out in the first 6 months, thinking it's really hard. You have to study around 18 to 19 hours a day. You go through patients, you go through books, you go through your teachers, you go through your seniors, and managing all that. You even go through your family. Like, it's an ambitious thing to do, and yeah, eventually it happens. It happens. Eventually it happens.
So, sir, like the theme of the event is about regarding the inspiring the youth, sir. So, what is your message to the youth?
So, what I say to the youth, even my little brother is has currently given CE exam, and he's currently doing in a phase of being entering into MBBS, and he's kind of confused. So, what I told my brother is, um, do what your mind and heart says you to do. If you have an interest in medicine, you can do it. Just don't think about anything else. Don't think about what the people will say. Don't think about what others will say, what will happen. Don't expect anything from anyone else. Just you do it. It will eventually be done. um I'll give my example myself. Okay, I gave my exams, my first year exams, it didn't go well. I even failed two subjects. And I see all my friends passing and they're like, "Garo bhai," I'll say it in Nepali, "Garo bhai, chhod de ni ta." I know. And even my family, they're like, "Garo bhai, chhod de ni ta." And I'm thinking, I was in the library and I'm like, I came to study this. uh, I should be doing this. It's not the failure that should stop you. It's you. And if everyone can, you can as well. Yeah. So it's not a big so you can do it.
And sir, when you are looking a lot of patients
Mm.
now, looking into the scenario where 20, 30 years back there were more geriatric patients with metabolic syndrome. Today, more younger generation is. So, how you see this change and how you are tackling the situation? This.
So I, for one, would say young people are getting into metabolic diseases is mostly because of the diet. I see diet and lack of exercise. So whatever we do it in a room. Like recently we see people all are working from home. Like, you sit around a desk, you sit around a table, you're doing things, and you have no physical exercise. Even us, our profession, um, any field, even surgery, non-surgical fields, we're just in a table doing things. People think they're working, but they're working mentally. Their physical body is not being active one. So our diet is mostly composed of carbs, trans fat. Everything we see, I say to my patients in Nepali, tareko, poleko, bhuteko are the only things we're eating. Everything we eat is ready made. So that's causing so that's the leading cause of metabolic syndromes now and then. Geriatric age group, I have seen very less geriatric patients now and then. Only see I see people less than my age getting diabetes. I've seen patients getting hypertension. Recently, 2 days back, I diagnosed a 16-year-old patient with renal failure. So that's hard actually. So I think it's mostly because of the sedentary lifestyle and the way you eat.
So, what are the preventive tips, sir, you would like to give to the youth today that they, like you said, a 16-year-old patient. So, what are the preventive tips you would like to give to such patients?
So I would say, like I say to my patients, at least get 1 hour of exercise, um, at least once a day, at least once a day for 1 hour. You should be doing something strenuous um, that makes you sweat, that makes you breathe out of air, that makes you feel a bit difficult, I say to my patients, give stress to your body so that your body recapitulates it and gets it in a point key. You're adapting to the world changing around you. It's not only about how you work. You work every day. You should also be doing something for your health. 1 hour to your health is nothing in 24 hours. um, I say that to all of my patients.
So, sir, one thing very important, you said that 1 hour, that one golden hour is very important for the health, sir. So, thank you for your this suggestion. I think your patients or your relatives or the society, when they will hear this, they may start using that one golden hour for their lives, sir. Thank you, sir.